Yes, ma'am.
Is what I said clear? Hello?
Yes.
Okay. Right. Venkatesh, where are you from?
Myself, Venkatesh from Telangana, madam.
Telangana, right? Right. Okay. Fine. So there are multiple people from different part of India. So we'll be taking the class in English, right? Your doubts you can ask either in Hindi, English, or in Malayalam, right? In whichever language you're comfortable. As far as our academy is concerned, we provide classes in all these three languages, right? Okay. So let's start. So I'll be taking the topic pharmacy ethics, right? It's a small topic, but a lot of question, a twisting type of questions come in Gulf exams, right? So see, when we are working as a professional in a hospital pharmacy, or as a clinical pharmacist, or as a pharmacist in community pharmacy, there are certain situations in which we have a dilemma, right? What is right and what is wrong, and we have difficulty taking a decision. Okay, I hope you understood. So pharmacy ethics na help us. These rules and rules of ethics help us to take a correct decision in a situation where we have a dilemma, right? Where we don't know what is right and what is wrong, right? Okay, so for example, the example that we usually take, see is somebody you have, suppose a child has come, right, who's above 18 years of age and bought something from the pharmacy, right? A child came, bought something from the pharmacy and went. Okay, behind that, if the child's mother comes and asks you what my child bought from the pharmacy, will you tell the mother what the child bought? The child is 18 years old, more than 18 years. Do you have the right to tell the mother? Is it
No.
right? No, right? That's what. No. So, from a mother's point of view, she is in charge of her child, right? And she has all the right to know. But we, as our professional, we should never tell her, right? Because it's the rule, right? So, in such situations where we have what dilemma, na, this pharmacy ethic principles will help you or guide you to take a correct decision, right? Yeah. Right. So what are the core principles of pharmacy ethics? We have four core principles. First one is autonomy. Second one is beneficence. Third one is non-maleficence, and fourth one is the justice. Now, what is autonomy? Autonomy is the patient's right to take his own decisions, right? So, as a professional, healthcare professional, what is our duty? Our duty is to inform the patient what and all treatment he has, right? What and all treatment options he has, and what are the advantages and the disadvantages, right? So, in front of him, if there are three different options, we will tell them, see, there are three different options. These are the advantages of these, and these are the disadvantages, right? Now, it is the patient who has to decide which treatment he wants, right? And he also has the right to decide not to take any treatment, right? So, whatever he decides should be what? His own, right? The decision that comes from the patient should be what? Should be taken voluntarily. Means we should not force the patient to take a particular treatment, right? Now, who has the right to autonomy? See, every patient cannot decide for themselves, right? So, who has this capacity to take a decision? Those who have the capacity. Capacity means they must be above the age of 18 years, right? Below the age of 18 years, who will take the decision? The parents will take the decision, right? They are the guardians of the children, right? They are the legal guardians. Yes. Now, second thing is, if the patient has a mental illness, right? He is a patient with mania or any psychic disorder, then he's not in a capacity to take a decision, right? In that case, also his guardian will take the decision, right? And if the patient is unconscious, right, he cannot take, no. So these are the three conditions in which what we say the patient doesn't have a capacity to take a decision, right? So in all these three cases, who will decide for the patient? Who will decide? They can't see you, no, people you have not.
Guardian.
Yeah, the guardian will take the decision, right? Now, so that's the first thing is capacity. Second one is disclosure. Disclosure means you have to tell the patient. We said there are three different options, no? A, B, and C, right? You have to tell the patient everything regarding A, B, and C. You should not hide anything from him, right? So in your mind, you might think that A is the best treatment. So you might say, no, good things about A and don't uh, disclose everything about B and C. That is not right. So you have to give complete, clear, okay, information, and that should be what? In an understandable manner. That it should be in a language in a way that the patient is able to understand, right? So you have to tell the risk, benefits, alternatives that are available, everything, right? That is disclosure. So you have to disclose the whole information, right? And the patient should decide freely without any pressure. Okay, pressure can be exerted by the healthcare professional or from the society or from the family. Yes, you can go and ask the child of a patient to go and get your father this treatment, right? So that is not right. You should not do it, right? So the, whatever patient decides, he should decide it what voluntarily, right? Clear? These three. So that is your autonomy, right? Autonomy is to decide for oneself. Yes. Second thing is beneficence. Beneficence, how can you link it? Benefit of the patient, right? So you have to always work to benefit the patient. That is what? Beneficence, right? So if you have what three different options, and from this you know option B is the best, right? Right. So you what you should do? You should tell the patient that B is the best, and that's what you should opt for. So what are you trying to do? You're trying to benefit the patient. Yes. So that is what? Beneficence. So B for beneficence, B for to benefit the patient. Clear? Second one. Now, see, you have to tell me. Clear, na? Children.
Yes, madam.
Yes. Right. Say that, no? Right. Third one is non-maleficence. Now, non-maleficence, do not harm the patient knowingly. Do not harm the patient. Okay. Example that usually comes in exam. A pharmacist, no? He dispensed isotretinoin to a pregnant lady. Right? What he did? Can you give isotretinoin to a patient who is pregnant? Can you give? Answer is no. It is a drug which is contraindicated in pregnancy. So if a pharmacist has given it, means he has done harm to the patient, right? So which principle of ethics did he disobey or did not follow? Answer will be non-maleficence. Okay. What does that tell you? Do not harm the patient. Do no harm, right? Autonomy, patient has the right to decide for himself. Beneficence, you should work to benefit the patient. Yes. Non-maleficence, do no harm, right? Now, what is justice? Justice is when you have a lot of different patients in front of you, some of which you know personally, right? And they are standing in a queue, right? And that friend sees you and thinks that you might give him or dispense a drug early to him and breaks the queue, comes to you and asks for the medicine and you give it to him. What you did? You didn't treat everyone equally, no? Yes. So that is justice. You have to treat all the patients fairly and equally. You should not give any special care to any race, any gender, any nationality, or to any person from a different economic status, right? Rich, poor, middle class, everyone should be treated equally, right? Clear? Your close ones, your relatives, or a complete stranger, how you should treat them equally, right? That is called what? Justice. Okay. Are four core principles clear? If you have any doubt, you can ask. अगर doubt है ना, you can ask. No problem.
Clear.
Clear? Anusuya, Arshia, Shabana, Shabna.
Yes, ma'am.
Clear.
Clear, ma'am.
Yeah. Clear, no? Okay. Right. Now, rules of ethics. What are the four rules of ethics? First one is confidentiality. Second one is veracity. Third one is fidelity. And fourth one, the accountability. Now, what are these? Confidentiality, whatever information you have of the patient, that is private. You're not supposed to share it with anybody else unless the patient gives you the permission. Means whatever information you have, what disease the patient is having, which what is his age, where does he live, right? What are the drugs that he's using? Whatever information you have of the patient is what? It's confidential. We say confidential documents. Similarly, patient's information is also what? Confidential, private. You're not supposed to share it with anybody. Anybody means anybody. Okay. Without his consent, right? So suppose you are a physician, suppose, right? The physician from the other department comes and asks about the patient. Can you tell the patient? Can you tell the physician?
No.
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 No. Answer is no. You should not tell. Right?
Even the parents also, madam.
No. If the patient doesn't want, that's what I said. No. If a child comes, child means above the age of 18 years, right, comes and buys something from the pharmacy, and the mother comes running behind asking you what my child bought. If the child is more than 18 years of age, you don't have the right to tell the mother. Okay. That's why I said, no, you are in a dilemma. Our society says, as per our human ethics, what do we feel? We have the urge to tell the mother, no? right? Because we know she might be concerned. She might be the only
Yeah.
person in the whole earth, no, who will be concerned about her child. But even then, that is not ethically right to tell, right? Clear, no?
Yes, ma'am.
Right, that is confidentiality. Now, second one is veracity. Veracity means whatever you're giving, no, the information or the care, you should be honest and truthful in that, right? So whatever information you're giving to the patient or to any other healthcare professional, whenever you are in your profession, no, whatever you do, whatever you say, it should be what? Truthful, right? Truthful. Even if it means that you are going to be in trouble, right? You should be what? Truthful. Especially in cases na, when the patient is concerned about his treatment and is asking you whether these drugs have any side effects. We usually have a tendency to hide it, no? But the thing is, if it is there, you have to tell the patient that, see, these are the side effects which you will have to what? Go through if you use these drugs. Now that then only the patient will be able to take a clear decision. No? Yes. So we should do our best to give him what? A clarity, right? So that he can think and take a good decision for himself, right? So that is what? Veracity. What veracity means? Being honest and truthful. Okay, truthful. Third one is fidelity. Okay, fidelity means to being loyal. Okay, being loyal. Like suppose you told a healthcare professional, see, I'll take the night duty tomorrow, you take mine today, right? And tomorrow when that person came, you said, I won't take it. Now that's being what? Not truthful, not being loyal, right? So you should be loyal. So if you make any promises, right? If you take up any responsibility, you have to what? Fulfill it. Okay, fulfill it. So that character is called what? Fidelity. Fidelity is being loyal. Okay, loyal to one's own profession. Okay, profession. With the promises you make, any responsibilities you take up, you have to fulfill it. Right? That is fidelity. So last one is accountability. Accountability means if anything happens from your side, you have to take up the responsibility. Doesn't matter in which position you are. You should never ever what? Put the blame on your subordinates, right? This happens, no, in many what companies and all bosses who are not that a leader's quality. It is not like this, no. A leader, what he does, he takes up the responsibility. No, if a junior has done something wrong, he will take up the blame on himself, right? So that is being what? Accountable, right? If somebody under you has done anything wrong, you should what? Take up the responsibility to get it corrected, right? So that is accountability, being responsible for one's own actions. It can be that you might have given a wrong drug, or dispensed a wrong drug. Can happen, no? We all are humans, right? So you must take up steps that you can to prevent harm, right? And then admit it that something wrong has come from your side, and report it and take preventive measures. Okay, that's what is accountability, taking one's own responsibility for one's own action, right? So what is confidentiality? Confidentiality is keeping the information of the patient what? Private, no?
Yeah.
Private.
Private.
Private, not disclosing it to anybody else, right? What is veracity? Being honest and truthful, no, to the patient as well as, yes, to the healthcare professional. What is fidelity? Fidelity is being, come on,
Loyal.
loyal. What is accountability? It is being
Responsibility.
taking up the responsibility. Okay, responsibility. Clear, no?
Ma'am, what is the difference between fidelity and veracity?
Yes.
Both are same.
Somewhat same. Being truthful is, see, you're not supposed to lie, right? That is veracity. Being loyal is being what? Fidelity. Now, if you, that's what I said. See, if you make a promise and make or take up a responsibility, you have to fulfill it. That is being loyal to your profession, right? Somebody asks you about the side effects, you have to tell them the truth, right? Not hiding it. That is veracity. Okay. See, in question, when they ask, they will give you a clarity what they actually want to know, right? So how do they how I have seen question comes, they will ask which rule of ethics is related to being loyal to one's promises. So then you know it's what? Fidelity. Okay. It will not be confusing. Don't worry. Clear?
Yes, ma'am.
Okay. Right. So we'll take up the questions, okay, that have come in exam. So which of the ethical principle do you violate as a pharmacist when you prioritize giving consultation only to relatives whom you're considering? Justice, no? Right? Justice. You have to treat everyone equally. But what you did, As a pharmacist, you gave more prioritized consultation to
relatives.
relatives. That you should not do. Yes, autonomy is what? Giving the patient their right to take a decision, right? Beneficence is work to benefit the patient. What is non-maleficence? Do no harm. Yes? Yes. So answer here is justice. Good. Now, a 25-year-old man with leukemia is admitted. Yes, we have a 25-year-old man with leukemia who has been admitted, right? Now, who among the following can assess his medical records without special permission? Now, without any special permission, who can go through his medical records is the question. Okay. So, options are patient's cousin who works as an outpatient nurse, right? Medical resident in pediatric curious about leukemia risks, clinical nutritionist assigned to calculate the patient's nutritional needs, pharmacy resident doing research on cell transplant, who has the permission to go through his medical records.
Option C.
Option C. Na? C. Na? So it is clinical nutritionist. Na? Why clinical nutritionist? Because he has to what? Get the food ready for him. Na? He will decide what the patient is going to have and not have, right? Right, during his meals, right? So he is directly involved in patient's care. Yes, that's why clinical nutritionist. Now, patient's cousin who is an outpatient nurse has got nothing to do with the patient, right? Patient care, right? Similarly, a medical resident who is curious. If he is curious, he has to get the permission from the ethics committee before he can go through it, right? And pharmacy resident doing research on cell transplant, go and get a what? Permission from the ethics committee. Only then he can go through the records, right? So who can go? We said clinical nutritionist. Clear, no? Clear? See
Yes.
how?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. Now try to give the answer. Okay. Those who know now, wait 5 seconds and then give the answer. Don't jump into the answer. You might know. Give others also a chance to think. Okay. Yeah. So isotretinoin is contraindicated during pregnancy. We have taken this example, right? So isotretinoin is contraindicated during pregnancy. A pharmacist knowingly dispensed it to a pregnant woman. Which ethical principle is violated? Okay. Justice, beneficence, non-maleficence, and autonomy.
Non-maleficent.
Non-maleficence, right? Means do no harm, no? He
Do
violated.
no harm.
Yeah. Do no harm is non-maleficence, but he violated it. He did harm to the patient, pregnant women, right? He dispensed a drug which is contraindicated, right? So answer is C here. Okay. Last one. A patient refuses to take a life-saving medication despite understanding all the consequences. What should the pharmacist do? Inform the patient's family and ignore the patient's wishes. Administer the medication secretly. Respect the patient's decision. Convince the patient using emotional pressure. What should be done? We have a patient who is not taking a life-saving medication despite understanding all the consequences, right? So as a pharmacist, what are we supposed to do? Should we inform patient's family and ignore patient's wishes? Should we do that?
Convince the patient.
Convince the patient using emotional pressure, you're saying? What do you think is that? Usually in India, we don't do that. Huh.
Option C.
Option C is the right answer. Na? Respect the patient's decision. Na? See, these things happens now when, especially I have seen such a situation in clinical scenario, especially with patients who are in stage 4 of their cancer, right? And I have seen a case where a child, okay, maybe 16 or 17 years old child, she was asked to have a surgery and cancer was all spread, right? And the clinicians, they said it is good for her because that might increase her lifespan. But the child was not in any this thing to take the surgery. She said she can do the chemo, but not the surgery, right? She had many surgeries before, so she didn't want to have it, right? So that is patient's decision, and we should what? Respect it, no? Right? Okay, so respect the patient's decision, even if it is what? Life-saving medication. Yes. Now, life-saving medication, we said. We didn't say it is emergency, that if you don't give, the patient will die. If you are in such a situation, right, where the patient might die if you don't give the drug that during that time, and if that is a child also, and the parents are not allowing, suppose, you can go and give the drug. Okay, life-saving drug is different, emergency situation is different. If this situation is an emergency situation where the child may die and the parents are not allowing you to give the life-saving drug, right? There you can go against the parents and give the drug. Clear? But here it is a different thing. Clear, na? नहीं हुआ clear जवानिका अभी?
Clear, ma'am.
Clear है?
Clear.
Right? So we'll go through the syllabus, right? See, whatever pharmacist exam you're writing, whether it be the Qatar or the DHA or MOH, okay, right? Most of the exams, they have 4 different areas from where the question come, okay, even for SPLE, right? The first domain is the basic biomedical sciences, okay. Here you will see questions coming from areas like biochemistry, right? You have the central dogma of molecular biology, like transcription, translation, such things. Yes, they study that, DNA, RNA, right? And then glycolysis, citric acid cycle, okay. So questions from such areas come in where? In the basic biomedical sciences, right? Then the second domain is pharmaceutical sciences. Here you have the calculations, right? And the Sutix and the cognosy a bit, right? So questions like calculations, typical calculations like you have to calculate the dose, right? Or you have to find out the strength in equivalence, or you have to find out the diffusion rate, okay, drops per minute, or questions come from kinetics portion also, like you have to find out the half-life or volume of distribution. Okay, such questions come from pharmaceutical sciences. Or what is the use of bentonite? So we know it is suspending agent, right? Emulsion, suspension, right? Question from these areas come, right? And cognosy part means herbal drugs, like what is the test that is used to identify alkaloids? So answer will be what? There are different tests, no? For alkaloids. You have Meyer's, Hager's, Wagner's, Dragonroff, right? Typical test for alkaloids, right? So you might find any one of these. Usually we have seen Dragonroff option, okay, in options, right? So such questions come from which domain? The pharmaceutical sciences, okay. Then we have social, behavioral, and administrative sciences. So the thing that we studied, no? Ethics right now. It comes under which domain? The third domain, right? And it from which portion in this? Behavioral sciences, right? So in a situation, how are you supposed to behave, right? Take decision. That is what? Behavioral, right? Administrative sciences, you will have questions coming from like different countries, it will be different regulations and all, like for how many refills you can give for a control drug, right? So there are no refills for control drugs. Answer will be 0, right? So such questions come from domain 3, right? And finally, the most important domain is the clinical sciences. Almost 40 to 50% questions that come from clinical sciences, where you will be given a case scenario, and finally you will have to what? Choose the right option. Okay. So we will take one question from each of these domain to see. Okay. So most important here is which one? The clinical sciences. Okay. Then the least important is your basic biomedical sciences. I'm not saying it is not important, but compared to other 3, no? Few questions come from this area, right? Pharmaceutical sciences and social and behavioral sciences and clinical sciences. Most important being which one? The clinical science. Clinical sciences, right? Now, so if you look at the pharmacist and the pharmacy technician syllabus, no? Right? Syllabus, there are a lot of topics that are common, right? So you see in toxicology, and this medicinal chemistry, these portions, medicinal chemistry is, we are studying the structure, everything, that you won't find for pharmacy technician. But other things are like sterile compounding, pharmaceutics, pharmacognosy, calculation. Okay, in calculation also kinetics won't be there. This kinetics, it won't be there. But the simpler ones, okay, like you have to find out the T-half and all. That such type of calculations will be there, but not the steady state type, right? So difficult ones won't be there, right? Then medication safety, over the counter, you have these here also, pharmacy law and ethics. So most of the topics for pharmacist and pharmacy technicians are same, but the difference comes in the depth in which they are asked. Okay, so in pharmacist, it will be more twisting, right? They will give you a lot of different values and all, and twist it and turn it and to make it confusing, right? In pharmacy, so you have to learn in depth. Whereas for pharmacy technician, they will cover only the what? Periphery, no? Right? The periphery is also very tough. Okay. So when I say periphery, just don't think that you can just read it and go and get it. No, it's not that easy. Compared to our B Pharm, no? B Pharm syllabus you have seen, no? Or D Pharm syllabus, right? And we all have passed that thing, no? Pharm D, whatever it may be, right? A degree syllabus. So it is not like writing those, right? You have to learn in depth. Your concept should be clear, right? So if your concepts are clear, no? Doesn't matter how twisted the question is, you'll be able to answer it, right? So what we try when we teach is to make the concepts clear, right? So when you know, now you know what autonomy is. Yes. Now you know what beneficence is, right? So even if the question, they twist and turn, no, you will know the concept, no? Right? And will be able to answer, right? So that's what we try when we teach, right? So the basic difference is in pharmacist, you will have what? Questions coming from the clinical side more, right? Medicinal chemistry will be touched, especially for DHA exam, okay? Chemistry in depth, you must know. There are certain areas from where more questions come, right? So we will be discussing questions that we have seen in recalls, right? Recalls are questions that students report now after their exam, okay? Right. Any doubts, children? Listen, I am the only one speaking. If you have any doubt, now you can always unmute and speak. Okay. Sia, Shabna, Ahmad, Razik, Nusi, Majid, Shahla, Rauna. No doubts? Okay. Let's take one question from each domain. Okay, let's see. Which enzyme catalyzes the conversion of RNA into DNA, an essential step in replication of retroviruses like HIV? Any guesses? Which enzyme catalyzes the conversion of RNA to DNA?
RNA polymerase.
Option C.
Okay, somebody has an RNA polymerase. Any other guesses?
Option C, ma'am.
Okay,
Yes, option C, ma'am.
right. See, how we got to this option C? When we synthesize RNA from DNA, what is this called? This is called transcription. Okay, transcription, right? And when you synthesize proteins from RNA, it is called what? Translation, right? Translation. So what is being done here? We are synthesizing, conversion of RNA into DNA. No? From RNA, you are synthesizing what? DNA, no? Right? It is reverse, no? Opposite of transcription. No? It is what? Reverse of transcription. That is reverse transcription, right? So the enzyme involved will be what? Reverse transcriptase, right? Transcriptase. Clear? Right. See, RNA polymerase means RNA is being synthesized. DNA polymerase is an enzyme which synthesizes DNA, right? So here it should be what? DNA polymerase. If you wanted it to be right, not RNA polymerase, no? Because you're converting what? RNA into DNA. No? What is the end product? DNA. No? Clear?
Yes, ma'am.
Yes, ma'am.
Let's see this question. Okay. 72. See, one thing I want to tell you this. The values, no? It's been given here, no? And I have given you a normal value, no? In exam, you might or you might not get the normal value, right? So when we take the class, now we will be telling you which normal values you have to learn. Clear, right? So for you to answer here, I have what? Kept it. The normal values I have kept, right? Otherwise, you will not understand what is wrong, what is right with the lab values. Yes. Okay. So a 72-year-old man with a history of hyperlipidemia has been on high dose atorvastatin therapy for past 6 months, right? So we have a 72-year-old man who has what? Hyperlipidemia, right? And what is he taking? Taking high dose atorvastatin. Okay, statins for past 6 months. He also has renal insufficiency. His recent lipid profile shows LDL cholesterol how much? 131, right? So LDL should be less than 131, right? So it's almost normal, right? What about triglycerides? It is 510. Triglycerides, 510 is what? High risk category, right? So this is what? High risk. Now, HDL cholesterol, 32. HDL is good cholesterol. You must have it in your body, right? So normal values is more than 60. You must have more than 60. Here, it is how much? Less than 35. No? So again, this is what? High risk case. High risk, right? High risk, right? So your triglycerides, the patient's triglycerides are high and HDL cholesterol is very low, right? Physician plans to add another medication to improve his lipid levels. Okay, which of the following is most appropriate agent to add? Now we are adding a single agent here, right? And we have two problems at hand. What? One is triglycerides are high and HDL cholesterol is low. Yes, right? So which is a single drug that can address both the problems? Any guesses?
Ma'am, fenofibrate.
Okay.
Niacin.
Okay. Niacin. Then,
Gemfibrozil, ma'am.
okay. There are two more options left. Na? Is there anyone who want to give those? No? Okay. Right. So Colsevelam and ezetimibe both reduce your LDL cholesterol. Right. They have nothing to do with HDL. Right. LDL cholesterol. Statins also reduce what? LDL cholesterol. Now we have fibrates and the niacin. Right. Both can reduce triglycerides. Both have the potential to reduce what? Fenofibrate, gemfibrozil, and niacin both can reduce what? Triglycerides. But niacin is the only one that has the potential to increase HDL cholesterol. Understood? Right. That's why the answer will be what? Niacin. Okay. Fenofibrate, gemfibrozil, they can reduce what? Triglyceride levels. They will address this problem, but not this. Right. So we have to increase HDL cholesterol also. No? Right. So in our body, we say lipid profile. Lipid profile. So lipid is two. What? You have cholesterol, right? Which we say LDL cholesterol. Right. And then we have triglycerides. These are the two things. Right. Okay. LDL cholesterol is there, HDL cholesterol is there. Right. We want LDL cholesterol to be what? In our body? To be low. Right. And what about HDL cholesterol? It should be high value, no? Right? More than 60. Yes. Triglycerides should be low. Yes. Now, which drugs decrease your LDL cholesterol levels? We said, which are the drugs that can decrease your LDL cholesterol among hypolipidemic agents?
Ezetimibe.
Ezetimibe can do it by reducing the absorption of dietary cholesterol. Okay. So ezetimibe can do it. Colsevelam, it is a bile acid sequestrant, right? Which can bind to bile acids in your body, right? Gut. And bile acids are synthesized from cholesterol only, right? So when bile acids are eliminated through stool, your body utilizes cholesterol to synthesize more bile acids, right? So like that, the cholesterol levels decrease. So they also reduce your LDL cholesterol. Statins also reduce what? LDL cholesterol. So statins. Okay, atorvastatin, simvastatin, whatever statin you have, they also reduce what? LDL cholesterol, right? Your fibrates, gemfibrozil, right? Fenofibrate, all these things, they reduce triglycerides. Yes. And your niacin. What is the other name of niacin? Anybody? It's also called
Nicotinamide.
nicotinamide.
Wait.
Nicotinic acid. Okay. And vitamin B3. Okay. Nicotinic acid. Nicotinic. Right. Nicotinic acid, vitamin B3 or niacin. All are same. Right. They reduce triglycerides. They increase your HDL cholesterol. Right. So because we wanted our HDL cholesterol to rise, the answer will be what? Niacin. Right. Okay. Clear? By the answer, niacin. Yes. Right. So this type of questions is what make up 40 to 50% of your exam. Okay. And you might have seen children what scoring good marks in other domains, but getting very less marks in clinical sciences, and that might be the only reason they fail in the exam, right? But if you get very good marks in clinical sciences, even if you get less marks in others, you might pass. Reason is a majority of questions come from that area only. No? Okay. Right. Okay. So as you know, there are different exams in Gulf countries. We have DHA, Qatar, Oman, right? MOH, Bahrain, Hard, and Saudi exam, right? A good news for those who are preparing for SPLE is that if you have done a PharmD course, you can write the pharmacist exam, right? Till last year, we didn't have that permission, right? Even PharmD students were not able to write the pharmacist exam, but now from this year onwards, you can write the pharmacist exam if you are a PharmD candidate. Yes. Now, DHA, anything special you want to know?
Ma'am, for SPL exam is for pharmacy holders. Only pharmacy technician is available, ma'am.
Yeah. For only those who have done a pharmacy course which is 5 years long. Okay, without a gap, they can write pharmacist exam in the Saudi, and in India it is PharmD, no?
Okay, ma'am.
Yes. So even after having a PG, he cannot write pharmacist exam.
So equal to pharmacy technician even after doing pharmacy.
You will have to write that. You can only write that exam there. Doesn't matter what you have, diploma, B.Pharm or M.Pharm. You can only write assistant pharmacist exam there, pharmacy technician exam. It's only about Saudi. In Saudi, it's like that. What to do? They have their own policies. So DHA, you can write the pharmacist exam if you have done B.Pharm, or M.Pharm, you can write the clinical pharmacist exam. Right? Question paper is going to be the same for pharmacist and clinical pharmacist. Difference will only be there in the percentage that you need to score. Right? If you're writing for pharmacist, you need to score 60%. Right? And if you're writing clinical pharmacist, the same paper you will have to score 70%. Right? Okay, so exams will be in exam you will have 150 questions, right, coming from all the 4 domains that I said, no? Right? It will be almost 2 hours 50 minutes long, right? Once you complete the DHA exam, no, it will have a validity of 5 years, which is the attraction here, no? Right? And it doesn't have, you don't have to do the data flow also before writing the exam, right? So DHA, that is the major, but good thing about DHA is that those who have just passed B.Pharm, no, they too can write it, right? Why? Because it has a big validity in 5 years, and to do data flow, you need how much? Only 2 years, right? 2 years experience you must have, right? So once you pass your B.Pharm, right, exam, you will be in good touch with all the portions, no? Right? Because you have currently studied all that, right? So the preparation will be easy for such students, right? And they can write the exam. 6 months preparation is all that I'm saying 3 months preparation is all you need, right? If you are not doing a job along with that. But if you are doing a job, it might take you 4 to 5 months, right? Depending on how much time you spend, right? There are students who pass it in 2 months. There are people who take a year, right? So it depends how much time you're able to give and what is your level of studying, right? All are created different, right? So average we take 3 months, right? So prior data flow, nothing is required. But for other exams, Qatar and Oman also, you don't need a data flow. But the thing is, they don't have much validity, right? So those who have experience can write these exams, right? But if you don't have the experience, no, it is better to go with DHA, right? And you can convert DHA to hard or MOH also, no? Later on, if you don't want to work in Dubai and want to go to other Emirates, right? You can convert it if you want, right? To MOH or to Abu Dhabi exam, right? So others you have to write separately. Qatar, Oman, Bahrain, and Saudi you have to write separately. Cannot convert it, right? But DHA, MOH, and hard it can be interconvertible. It's interconvertible. If you have any doubt, you can ask children. Okay, so our course that we provide, no, for this, it is 2 months, right? Validity is 6 months, right? But the course duration is 2 months, means you can sit for online classes 3 times, I'm saying. Okay, same topics you can listen to, right? If you want, if you complete one round and you're not very much okay, or you still have doubts, you can sit again, right? And get it cleared thoroughly, right? Okay, so we provide notes also, which are topic focused on the topics, right? The notes that we send you will not be up to date. Means up to date means because see, we might send the notes, right? And next day or the day after, a week after that, we might get a recall in which a topic might be there, no? Right? So in app, everything will be what? Up to date, but we will not guarantee that your notes that are being sent, it will be 100% up to date. It will be 80%, but something might be missing. So app, everything will be what? Up to date. We cannot give you that, right? It's not practically possible. Okay, right. So that is your notes, right? Live classes, 44 live classes will be there, right? And for every topic that we take, you will have a topic-wise test in app, right? So after completing a topic, you have to go through the topic-wise test, right? To know how much you have understood about the topic. See, after every live class, the other day when you come prepared, right? I'll be asking questions, and if you have any doubt anywhere, you can always ask, right? I'll try my best to answer. In case I don't know, I'll refer and tell you, right? Nobody knows everything, no, on earth, right? So there might be areas which I don't know. So in case such questions come, I'll refer and tell you. But the thing is, thing will be clear, right? Now, apart from 44 live classes, you will be given 30 plus recorded videos, right? So in class, we cannot cover everything. So I'll be asking you to watch a recorded video and prepare and come, right? So you have to go and get it. You have to learn it on your own. If you have any doubt again, on the next day, you can come and always ask, right? Now, after the completion of 20 classes, we will have 2 classes devoted for question and answer discussion, where we will be discussing questions that have come in exam, right? So after I said the classes are going to be 1.5 hours long, right? It may go more than this or less than this depending upon students. No? Sometimes students make me repeat the same thing again and again, right? In such cases, it may go beyond 1.5 hours, means 1.5 hours. But sometimes all are in fresh mode and everything goes smoothly, right? So it may finish a little bit before that time also. So average 1.5 hours class will be there, right? So after 20 hours of class, you will have a 6 hours completely dedicated to question and answer discussion, right? A full mock test is also provided to you through app, right? Apart from that, whatever recalls we get, we upload that also in the app, right? So you can go through those recalls. Recalls are nothing but questions reported by students saying that this has come in exam. Understood, right? So those such things will be there in the app. You can go through that to get an idea from where the questions are coming and what type of questions are coming. See, all these exams are CBT, means they are computer-based test, right? And because of that, we don't get a question paper. Okay, so we depend on all the institutions. Okay, will depend on the recalls, right? So that is the base on which everything is. That is the base on which everything else is based, no? Right? Understood? Yes. So you have to take that really seriously, right? So question and answer discussion, this question and answer discussion is based on this recalls only. Clear? Right. So these are the different topics that we take, right? We're currently on, from tomorrow onwards, we'll be starting general pharmacology, right? We'll complete the ANS. A child passed from our institute on 30th. He said he had reported few questions, right? And a lot of questions has come from the ANS portion, right? So when we discuss these topics, we will discuss those recalls also, right? So it is not like you will be we'll be just completing a topic and moving forward to the next topic. No, we'll be discussing the points that have come in exam. Okay, so it's going to be what? Exam based classes, right? Not like what we studied in BPharm. Like you'll be studying the mechanism of action, then side effects, like not like that. Classification, not like that. Okay, this is a different type of study. Right. So then we will go to the CVS portion, right? Followed by antibiotics. Then you will have the Q&A discussion, right? So we also we don't only take clinical sciences. Now we take the statistics portion also, the calculations, right? The genetics area, the pharmacoepidemiology, right? Pharmacoeconomics, vaccines, right? All these topics are included, right? Pharmacogenetics. See, so apart from that, the clinical trials, ethics, immunoglobulins, communication, medication error, medication reconciliation, all these are non-live topics, means these topics video you will get, right? So after watching the video, you will have to go and do the test of these topics. Okay, so that all the topics are clear. Okay, once this is over, 44 days. So in a day, what you are supposed to do? You have to attend the live class, you have to watch a video, do the test on both the topics, right? That's what your 1 day target will be, right? So once you have done this whole thing, 44 days, then you have to, or in between, you can start solving files. Files are recall based questions only, right? So when you solve more and more files, then your concept will become more and more clear, right? So everything goes along. Clear? No. Now you are clear. हो रहा है?
Yes, ma'am. Yes, ma'am. Clear, ma'am.
Clear ना? बोल दिया करो ना क्लियर, मुझे लगेगा बस मैं ही बात कर रही हूँ ना आपके तो I can't see you ना people, so you must at least make some noise.
Yes, ma'am.
Right. Okay. So special technician classes. See, usually we provide classes from Monday to Friday. Right. Saturday and Sunday it is off. Okay. Off doesn't mean that you can go and what? Spend time. No. No. Off means if anything is pending. No? Pending, right? During the week, you can finish it, right? Any tests are pending, any videos that you haven't watched yet, you can do that, complete it, and solve more files during Saturday and Sunday, right? Monday, we'll go to the next topic, right? So you should not lag in between, lag behind, right? Now, in case you miss a live class, what is it that you can do? You can go and watch the recording of that topic. Understood? So in app, we provide the recording also of the live classes. Clear? So you can watch that, and next day when you come, you will be with us, na? Clear? You don't have to worry about what lagging behind if you miss a class or something, right? So Monday to Friday classes will be for pharmacists, not pharmacists, everybody. Okay, common topics, right? And in between, I might ask diploma students not to attend 1 or 2 classes, right? For them, special classes will be there on Saturdays, right? 7 different topics are there which you have to attend, right? So November 1st, we have completed one topic. Now, next topic is going to be working in pharmacy settings and brand names, okay, which will be taken on second Saturdays are off, no? So this Saturday is second Saturday, no? So next Saturday, okay, that is on 15th of November. Then 22nd of November, 29th of November, right? Then again, 6th, 20th and 27th, right? We will be done with this whole one round, right? Okay, so these are the topics, especially for whom? The technician people. In that, one topic only, the sterile compounding, no? The pharmacist also need it, right? So these things I'll tell, okay, just before the class, na, which topic you have to attend, which you don't have to attend, right? So if you have any doubt and all, that will be cleared, right? I'm the one teaching you. All the classes will be taken by me only, right? So here the Gafar, right? Not Gafar, sorry, Vishwanath, right? Nagar Naik. He from Karnataka. He passed the exam on 30th, right? So he always had too much doubt in calculations. Now he considered himself very weak in calculation. As you can see from the result also, he got very less marks in, not very less, a little bit less in clinical science, pharmaceutical sciences, but he covered in others, no? Right? So as people, we might be weak in one area, but if you can cover that in other areas, no, you will still pass the exam. And so he wrote the exam in 2022, right? This was a second attempt, and he cleared it with flying colors, we can say, because usually people pass getting only 60. Okay, he has got 73% in clinical sciences. So somewhere near 70, 65 to 70 is his percentage, right? We cannot say exactly how much because we don't know na, from which area how many questions came. So somewhere roughly between 65 to 70 he might have got. Okay, the percentage I'm saying. So this is Said, and he scored very good marks, right? So his were all above 70%. So it depends also on the question paper that you get, right? So everybody will not get the same type of question paper. Said, he said his question paper was a bit easy. So might be he studied a lot, or he might have got an easy paper. We don't know, right? These are the other people who have passed from our institute, right? Now, there is one more thing that we provide. See, the one that I talked about is the class that I talked about is paid one, right? If you want to experience how the classes are going to be, right, just before enrolling into this thing, you can take a free workshop, okay, 5-day workshop, which is free of cost, right? Anytime you can join, right? Go through the topics, everything. If you find it useful, then come and join us, okay? There is no compulsion, no, right? Nobody can come. You have the autonomy to decide. Yes. Right, free will, right? So experience it, take up free coaching, free workshop. If you find it to be useful, then do come and join us. We will help you out, right, to clear the exam. Okay, so we provide two different batches, right? One is the premium batch in which you will be given notes, test, okay, non-live recorded videos, live recorded videos, right? Mock test, everything, right? What is not present? See, I said the notes now will be couriered to you without taking in a single penny, right? So that will be included only in the 10,000 package, where we will be couriering you the notes, right? Notes will be couriered. In 7,000 package, no, note will be provided through app. Okay, so hard copy will not be given. It will be through app, right? 10,000 package, you will be given the hard copy couriered to you, to your address, including that is included everything, courier charge, printing charge, everything is included in the 10,000 package, right? So in 10,000 package, you also get to sit in live classes, mentor support, that is you can always ask your doubts during the class, outside the class also through WhatsApp. Okay, it will be cleared. And previous question and answer discussion, which we said after every 20 classes we take, right? So in 6 months, you will get almost 6 such classes. So yes, 2 plus 2 plus 2. No, 4 in one round now. So 12 plus classes you will get, right? Right. So previous question discussion, right? So you can participate in that also. Right. So these are the two courses. So when you download our app now, which is Proficient Learning app, when you download it, you can see two courses. One is 7,000 package, which I said, right? The live classes, your 10,000 package, right? So all you need to do is go to the store section. When you open this, app will appear like this, right? Here you will have home, batches, store, right? So go to store section, you can see the courses there. So a new batch starts tomorrow, 4th of November. Thank you. My job is done. If you have any doubt, you can ask. नहीं, कोई डाउट नहीं है किसी को भी
Madam,
नहीं. हाँ.
how to join free 5 days classes?
You can see this number, no? Down I have written, right? +917012811264, right? Message to that WhatsApp number. You can message there. They will add you to the. Just tell them what your details. Okay, your name, what you have done, right? Which country, which exam you want to write, and they will add you to the free workshop. Clear?
Okay,
That
madam.
is 5-day free
And
workshop.
when I get a hard copy, if I joined in Diamond Club, before joining the classes or after joining the classes?
Once you join the class, only then you have to make the payment. Once the payment is done, then we will initiate the printing everything. Printing is done already. We'll send that to your address. Otherwise, if you don't pay, we'll be in loss, na, Venkatesh.
No, madam, I'm not like that. I'm asking that if I paid the fee, then somewhere the
1 week it
gap
will take.
will be there to start
1
the
week.
class. So in that gap, I will get, or once classes are started, then only.
1 week before the class starts, na, we'll be sending it to you. Because everything, see, students, when they pay, na, we don't give it one person makes the payment, right? We will be sending him, then again another person will make the payment the day after, right? We will sending it again. It doesn't happen like that. So a week before, if you have made the payment already, a week before the classes, it will be initiated. So that we'll make sure that if you have made the payment early, we'll make sure that you have the notes with you when the class starts. Clear, Venkatesh?
Yes, madam. Thank you.
Okay. Any other doubts, children? Shabana, Sia, Rauna, Ashika, Sajaf, Fabi. कहाँ से हो आप सब?
एक्सक्यूज मी मैम,
हाँ, ask.
जो आप हार्ड कॉपी दे रहे हैं उसमें मॉडल पेपर्स आएंगे क्या
नहीं, मॉडल पेपर्स
प्रैक्टिस
नहीं
के
आएगा.
लिए?
नहीं, मैंने कहा नोट्स कहा ना मैंने.
जी जी.
हाँ, तो उसमें नोट्स ही रहेगा जो हम क्लासेस में लेते हैं ना. जो
हाँ हाँ.
हाँ, जो मॉडल पेपर्स जो है वो आपको ऐप थ्रू दिखेगा. अब आपको अगर वो आपको सॉलिड मतलब हार्ड कॉपी में दे देते हैं, आपको आंसर भी साथ ही साथ दिखेगा ना.
बिल्कुल बिल्कुल.
हाँ, सो सीबीटी एग्जाम होता है. एग्जाम कैसा होता है? सीबीटी. सो वी विल बी मिमिकिंग दैट ओनली ना.
ओके मैम,
क्लियर है ना?
थैंक यू. या.
Anything else, children? Sia, Razik, कहाँ से हो आप सर? Let me know you ना. Just a second. I'll stop recording, then